So yeah, in food allergies, specific particles from the food that we eat get labeled as a threat, and like I said, it primes the cells for that next exposure. And this causes the body to react to it as if it were a pathogen triggering a vast immune response. And the pathway kind of goes like this. The allergen particle first gets identified and is bound to its specific antigen. For a type 1 allergic reaction, right, or a type 1 hypersensitivity, it has to be what we call IgE mediated. The IgE mediated just simply means that it's an IgE antibody that is being bound or being released or created. The immunocomplex is then presented to a mast cell and says, look, here, a new antigen. And this triggers a release of a bunch of chemicals, more than we could really talk about in the scope of this show. But one of the more prominent ones that you might recognize is called histamine. These chemicals cause the symptoms that we then typically associate with an allergic reaction. And this includes itching, redness, inflammation, so on. And most reactions can be controlled using a drug, which is an antihistamine drug. It binds to the histamine receptors to block them, reducing the allergic reaction. Do you know what drug I'm talking about?
Yeah, I think I know the brand name, Benadryl.
Yeah.
I'm not sure if I can reproduce the more scientific name. Is it diphenhydramine?
Oh my god, yes, that's exactly it. So, in more severe cases, the reaction that I previously described progresses to what we call anaphylaxis. And in anaphylaxis, a few things occur. Now, this is where I really kind of know what I'm talking about. This is on the this is happening and you need to fix it sort of side of things, right? So, in anaphylaxis, shock occurs. And we're going to talk about shock here in a second, but I'm going to continue with the list. So shock occurs, bronchoconstriction occurs, rash occurs, and airway swelling can occur. So, when I say shock, what do you think of?
I I think of I suppose the numbness to the intensity of something that has just happened to your body. Like the thing that I've just seen is like so intensely like astounding and scarring that you're just kind of like stunned. But I'm more of, I guess, on a biochemical basis, like within the body, you're sort of unaware of what has just happened, even though you might, see something, you might not feel it, I suppose.
So that's a common misconception. Your
Enlighten me.
definition,
Do it.
your definition is a common
Do
misconception
it,
of what
please.
shock really is. So, from a medical standpoint, right? Shock is defined as hypoperfusion. Hypoperfusion. Are you able
Hypoperfusion.
to break down that word?
Hypo, I mean that is like the lack of
Yep.
like hypoxia.
hmm
Perfusion. I'm not really sure.
So perfusion is what we call blood circulating through the body, right?
Okay.
So when an organ is receiving the appropriate amount of blood to sustain life, it's considered appropriately perfused, or it's receiving its perfusion. Okay. In hypoperfusion, the organ or the body or whatever is not receiving the appropriate amount of blood to continue life.
I see. Okay.
Okay. So shock is simply defined as hypoperfusion.
Okay.
Okay. There are a lot of different types of shock. There's cardiogenic shock, which has to do with the heart. There's a thing called distributive shock. There is, an array of different types of shock. In anaphylaxis, it's kind of a distributive shock. Distributive shock is, and all these different types of shock are just different ways to get to the same result, and that's that hypoperfusion.
I see.
Right?
Okay.
So in distributive shock, hypoperfusion occurs as a result of distribution of fluid. The fluid is not where it belongs. Okay? So in anaphylaxis, you get this swelling, right? That swelling is called angioedema. Angioedema is just swelling of the vasculature. Okay?
Okay.
So in angioedema, when it occurs, there is more fluid there than there should be. So if we take blood, which is 92% water, right, and we pull fluid from it, and we put it somewhere where it doesn't belong, such as in the airway or in the tongue or wherever angioedema is going to occur, there's no fluid for the rest of the body. Okay? And as a result, we're going to have an onset of shock.
Okay.
There's two major stages in shock. There's compensated and decompensated shock. In compensated shock, you're going to see the body reacting to the fact that it's in shock.
Mm-hmm.
Okay? You're going to see it do things that is going to try to reverse that shock, right? So if shock is hypoperfusion, there is likely an associated lack of blood pressure, right? Because that's going to not be, if there's no blood pressure, how are we going to move the blood to perfuse the organs, right?
Mm-hmm.
So the body's going to increase the blood pressure in order to try and get perfusion to those
I see.
organs.
Okay.
You see what I'm saying?
I see exactly what you're saying, yeah.
What else allows blood to move around the body more? Increased heart rate, right? So if we increase the frequency that the heart pumps, we increase the overall volume and how fast and how efficiently it gets pushed through the body. Again, increasing perfusion, right? So these are all signs of what we call compensated shock. Compensated shock is where you want to find someone, and that's where you need to identify shock as a medical professional. And if you get to what we call decompensated shock, which is where the body's systems are overwhelmed, you're fucked.
Yeah.
Yep. You're going to start seeing the opposite. You're going to start seeing extreme tachycardia, which is a high heart rate, really high heart rate, right? If you think about it, the heart pushes the blood, which increases the pressure throughout the vasculature. So you would think that with a higher heart rate, you should ideally see a higher blood pressure. In decompensated shock, that's not true. You see a really high heart rate, but a really low blood pressure.
So whatever's going on,
that's the body being overwhelmed.
Yeah, whatever's going on has got to be pretty serious, I suppose.
Yeah, there's a whole bunch of ways to get there. Many ways to skin a cat, but at the end of the day, you want to avoid shock.
You also want to avoid skinning cats, of course.
Well, of course, they're lovely creatures, and if you don't like cats, get the fuck out of here.
Yeah.
But no, if you can avoid shock, most of the times you can avoid death.
Okay, nice.
Yeah, shock is what kills people.
So is compensated shock that initial sort of first step in the compensated?
It's your body trying to fix it.
Okay, so you can never go right to decompensated, uncompensated. I'm sorry, I forgot what it was.
even if you always start in compensated, whether that lasts long is dependent on the situation.
I see.
Essentially what's happening is your body tries to fix it, and when your body can't fix it anymore and it gets overwhelmed, that's when decompensated shock starts. So it depends on how quickly your body's going to get overwhelmed. You're missing all four limbs and you're bleeding, your body's going to be overwhelmed pretty quick, and you'll likely find that individual in decompensated shock right away.
Yes.
You know, it's just one of those things. But in terms of anaphylaxis, what's happening is fluid pretty much the long and short of it is the fluid ends up where it doesn't belong, right? And that causes a distributive shock, which again results in hypoperfusion. Hypoperfusion whether that be the brain, any other organ, doesn't matter. You have about 2 to 3 minutes before there is, it's about 2 minutes until there's damage, and then it's like 3 to 4 minutes until that damage is irreversible.
Mm-hmm. On top of the damage that's already occurred.
On top of
Yeah.
the fact that you might die.
Yeah.
But like aside from that, so shock is a real deal. Like it's scary. It's the oh shit, this person's in shock. Like
yeah.
holy shit, like we got to fix this. But the other thing that I have yet to talk about yet is bronchoconstriction. Do you know what bronchoconstriction is?
I'm guessing that it's the bronchial tubes in your lungs becoming tight.
Yep. Yeah, that's exactly right. That it happens in asthma, which is that's what asthma is. If you have that chronically, that's asthma pretty much. So yeah, it's the constriction of bronchioles, which are the smaller tubes in your lungs that move air. Well, they don't move air, but they are the pathways in which air moves.
Sure, yeah.
So air comes in to your mouth or your nose, into your trachea, down your trachea into your bronchi, which then get broken down into bronchioles. So, it's just a smaller section. It's just like arteries, and then after arteries, you go to arterioles.
Sure.
So that kind of thing. But yeah, they constrict, and when they constrict, obviously you can move. There's less volume that you're able to move in and out. So when you have bronchoconstriction, it's really bad things can happen, and it contributes to the downward spiral that exists when you go into shock.
Sure. Mm-hmm.